Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. Welcome to the Sniff Spotlight Series. We are so excited to have joining us today Elly Kutoff. He is the CEO of LifeScan Labs of Illinois. So Elly, it's great to have you here.
Thank you very much for having me. It's nice to be here.
So tell me a little bit about what LifeScan Lab is.
So LifeScan Lab is a clinical laboratory, which means that we test patient samples and provide diagnostic information to doctors and other medical professionals. And LifeScan primarily focuses on the sniff market and the assisted living market.
How was the lab founded?
So the lab was founded in 1996, and it was founded specifically also to focus on long-term care markets. It's been around for 25 years. It's been doing a great job.
So talk to me about your mission with LifeScan.
So LifeScan is different than most other clinical labs in that most clinical labs, the doctor or the nurse will draw the patient sample and send it to the laboratory. Alternatively, the patient themselves will go to the laboratory draw site, have their blood drawn, and then it will get into the laboratory that way. LifeScan, since we focus on long-term care, these are all homebound patients or facility-bound patients. So we do what's called mobile phlebotomy, where we send phlebotomists and other trained professionals to the nursing homes and other long-term care facilities to collect the samples. And that's generally between 4 in the morning and noon. They're out collecting samples. They bring them back to the laboratory, we test them and release results. Some higher acuity facilities, we bring it back at 6 a.m., 8 a.m., and get their results out by noon. Some of the standard facilities, we bring it back by 10 a.m. and get the results out by noon.
That's pretty quick. You were recently awarded by the mayor of Skokie. Can you tell us a little bit about that?
So every year there's Lab Week. Lab Week is like many of the other national weeks, is a week to honor laboratory professionals. And a lot of people in our lab have been very excited about what we've done this past year. And they reached out to the mayor's office and said, you know, you have this lab in Skokie that's really taken the weight of COVID on our shoulders. And they bragged a little bit about some of our accomplishments over the past year. And the mayor decided to come out and issue a proclamation in honor of Lab Week and in honor of all the laboratory professionals over at LifeScan Labs.
How is LifeScan leading the pack?
So in many ways, I would say, mobile phlebotomy is not a simple task. LifeScan is not simply a scientific endeavor of testing diagnostics and providing it to doctors. It's about a very strong operational foundation and making sure that our staff is out there every morning, driving around the city, driving around the state, driving around the neighboring states to get those samples back in time. So first and foremost, providing those high quality diagnostic information to these elderly people who are generally in the long-term care facilities and cannot go out to have their blood drawn. Just every day getting that right cannot be underestimated. It's an impressive feat that our people manage to pull off on a daily basis. Our laboratory recently, I was in the lab, and they said, here, come look at this. And we got a gold award from CAP. CAP is the Association of Pathologists. And every quarter they send samples to all the laboratories, and you test them and you report your results back to CAP. And they obviously check to see how close you are to what they think the sample should be reported as. And the award was in honor of the fact that LifeScan had a perfect score. So every sample sent to us over this past 12 months, we tested completely perfect. Now, many labs I'm sure can do that. LifeScan was certainly one of the few. But what makes it all the more impressive is that the head of our lab, right before COVID started, was out of the country. For the first couple months of COVID, he wasn't able to get back. As every business has had, we've had huge disruptions in COVID. Staff getting sick, staff being out of the lab, staff being exposed and quarantined, and all of the above. And it's not about a single individual. It's really about the system and the team there. But that the team was able to get a perfect score in a year like 2020 and 2021 really, to me, is tremendously impressive. So I was really very proud to see that. In terms of COVID, LifeScan has, when COVID hit about a year ago now, we had a decision to make. Do you lean back or do you lean in? When faced with this adversity, what do we do? Do we go and we say, LabCorp's out there, Quest is out there, they do 40 million tests, let them handle it? Or do we say that long-term care is going to be in trouble? People stuck in nursing homes don't have the ability to really quarantine themselves or take other precautions that most individuals can. Sheltering in place, being at home for months on end by yourself is not really an option if you're in long-term care in a facility. And we understood the huge need for testing. And I'd love to say it was quick and it was easy, and it certainly wasn't. It was an extended process of building a molecular laboratory and getting it right and perfecting it and perfecting it and perfecting it over and over again. So I would say LifeScan's led the charge in really leaning into COVID and making sure that, as I've told my customers, anybody who needed a test from the first day of COVID until today got a test. And it wasn't a simple task, it wasn't an easy task, and it wasn't a task that was available that many labs accomplished or that was available to many people in the country. So LifeScan's enormously proud of what we've done to really support our customers and the entire long-term care population during COVID.
Since COVID, you guys are doing COVID testing in SNFs. Tell us about how you guys were really leading the charge in that.
Before COVID, LifeScan was a company of about 100 people. Today, LifeScan sits at more than 350. It's not a simple task, finding highly qualified people who are able to go out there to the SNF and collect the samples correctly, finding highly qualified med techs to process the samples and to test the samples, making sure that every part of that system is perfect, because close is not good enough. It's got to be perfect. And LifeScan has really gone out there and worked with manufacturers across the world, suppliers across the world, to really bring the best in breed, the best in class to our laboratory and to long-term care patients and residents here in Chicago.
So talk to me about sourcing materials, especially during this time. There, not a lot of PPE on the market.
Right.
How did you guys source the materials so quickly to be able to service your clients?
So I would like to say it was easy and it was simple and it was quick, and it certainly was none of the above. Everybody remembers when masks weren't available last February and March and April. Everybody remembers the governors on the news conference banging the table and sending, send me ventilators and send me this and everything the government was doing. Boots on the ground was very different. In a laboratory, you require very, very specific things. The water we used is filtered and filtered and filtered. The pipette tips, the consumables that we use have to fit into a certain instrument. And with the heavy robotics that LifeScan uses, there are very few manufacturers that make consumables for those instruments. So it was not simple. It has not been simple. But what LifeScan has done is we've gone through an iterative process. So we started buying instruments and using consumables that were available, all the while getting on the longer-term lists of things that we knew we needed to get to really ramp up our lab to get to the high throughput that we currently have. In our first conversations with Thermo Fisher, they were telling us it's a 3 to 6 month delivery time on some of our instrumentation. So we reached out to some of our longstanding relationships with Illinois Department of Public Health and other government offices, and we spoke to them about the need that we see happening in long-term care and how our patients, our residents need testing, and they need testing now, and they need testing quickly, and they need short turnaround times. And we've always been at the forefront of that population. So at the end of the day, I got IDPH to write a letter to Thermo Fisher saying, hey, put them at the head of the list. Those 3 to 6 months turned into 12 weeks. Wasn't simple, but it came through. It has been a difficult year in terms of sourcing materials. And the more specific and the more exact your materials had to be, the fewer places you were able to source them from. Certain components for the robotics that we use come from Germany, come from Austria, Switzerland, England, across the globe. You have to find the right people. You have to let them know who you're servicing and why your patients are important, why your people need to get tested now. And long-term care has always been at the forefront or in the media as much with COVID. And we went ahead and we spoke to all of our suppliers around the world, making sure that they can get us what we need, and mostly in quantities that we needed. It's amazing at the end of the day when you speak to people around the world and you think There's so many different things about different nationalities, different languages, different people, different positions in corporations and the like. But at the end of the day, COVID made everybody the same. Everybody was sitting at home, everybody was on the phone, everybody was trying to get testing, trying to get PPE, trying to keep their family safe, trying to figure out how to get, a carton of eggs at home without exposure and all those other things. So you just really have to connect with people and speak to them about what you're trying to do to make the world better. And they respond, and they get it done. I'm very proud of our team. We got a lot of things done very quickly.
So COVID seems to be constantly changing and switching. How has LifeScan been able to adapt to this constant change?
So we started with working with national labs that had large capacity last February. And at the time they said, yes, we can do your COVID test, but we have no collection kits. So we went and we bought our own collection kits and found them. And then the collection kits ran out. And then we went ahead and we took apart collection kits in the conference room table. We took each and every piece of it and we wrote down the different elements that make it usable. It's sterile, it's free of RNA, DNA, it's polyester swab on a plastic shaft, all the different elements that it was. And then we went looking for things that met exactly those criteria, but were not collection kits. So a transport tube is substantively similar to a centrifuge tube. Different color cap, different shape, but at the end of the day, it's pure, it's clean, and you can put saline in it, put a swab in there and send it out. Every day something different. What is short today? What is missing today? Where can we find something similar and put it together, and how do we get it done? I spoke about the iterative process of the different instruments that we had to get to make COVID happen. There was a time that we purchased 7 figures of instruments and consumables that we knew we were not going to be able to use much more than 2 months. It's just the way we were beating them. They weren't going to last too long. And the way we had other things coming through that were more automated and allowed for a higher throughput, they were 2 months out. So going ahead and taking those big leaps for a very narrow, very short period of time, knowing that we're going to turn everything over, call in electricians, add extra outlets, put in different shelving, rewrite the workflows, rewrite the protocols, get different plastics, all of those for a 2-month period, because this is what it's going to take to get through the next 2 months. And then 2 months from now, we're going to have to do it all over again, because we're going to be able to find higher throughput instrumentation. Has been a challenge. It's been every day something new. But again, we've got a great team. They've worked with a lot of different people around the country, around the city, and everybody understood it was a pandemic, and everybody understood where we sat in that pandemic, and they were happy to oblige. They got it done, and we were able to really take care of a lot of people, a lot of patients here in Chicago.
First of all, this sounds like a ton of camaraderie and friendship and thinking out of the box, bringing things together. Tell us how you guys dealt with the skilled nursing facilities in particular.
So skilled nursing facilities are some of the best people in healthcare. They've got a huge task taking care of everybody's grandmothers and great aunts and grandfathers and cousins and the like. And they don't necessarily get the credit, or they don't certainly get the credit that they deserve for it. And as a lab, it's always been our focus to make sure that we make their life easier. And just to give you a short example, when COVID first started, you had to fill out a piece of paper for every sample. And, it's fine if you and I go to the doctor and we fill out one paper for ourselves or our kids. But if you're a nurse on a floor and you got 200 people, you're filling out paper, that's a lot of paper. And just to get it right and get it perfect every time, because again, you miss a number, you miss a letter, results go to the wrong person. It was quite a lift for them. It was quite a hassle for them. So in working with them, we designed a different system where they sent us lists of everybody in the facility the day before, and we would put them onto labels, and we would send them labels with barcodes on it. And rather than having to handwrite a whole long paper of all the tests and the birthdays and the socials and all the other information that goes on a piece of paper, on a lab requisition, they just looked at it, peeled the label, put it on the tube, and shipped it off. And we had a tremendous response from them. I mean, they really appreciated the fact that we understood their plight, we understood what they were going through, and we tried to make it a little bit better. We look at it today, May of 2021. You have to remember what June, July was like of 2020. They were in the eye of the storm, and it was not easy on them. Those that showed up and those that pulled through every day, really, there's a lot of people that owe their lives to them. I mean, nothing short of that. And we're glad to be a small part of that and be able to make their life a little easier in ordering their testing and making their life a little easier in getting them their testing as quickly as we did. And it's really something LifeScan's been very proud of over the last year.
So how long does the testing process take, and did it speed up over time as you guys got better?
Yes, certainly. So the test itself, there's multiple steps to it. And as different tests or assays are, molecular biology, which is what the type of COVID test, the PCR test, is one of the most complicated out there. So the test process in the lab from beginning to end is about 6 hours. And it goes on different instruments, different chemicals. It extracts the DNA, it purifies the DNA, it sets up the plates, runs the DNA, and then they have to be resulted. So if you walk the sample in the lab, about 6 to 7 hours later, you can have a result. When you add to that collection time and processing time, so sample coming in has to be entered. Now that we have the stickers and the barcodes, that goes much faster for our staff and for the nursing staff. And then the collection, everybody's had a PCR test done, a nasal swab, it's a few seconds, uncomfortable, but a few seconds. Put it in the tube and move it on out, 20 minutes, half an hour of delivery time. Currently, LifeScan's running at about 8 hours, so from when it walks in the door until the result goes out is about 8 hours. For months and months, we've been improving it and getting it better, and a lot of it was really due to the fact that once we had a system that worked, we looked at seeing how can we have it work better, how can we have it work faster, how can we put more samples in that throughput. And at one point we were doing plates of 15 samples, then we're doing plates of 96 samples, then we're doing plates of 384 samples. At one point we had lab assistants manually decapping the tubes and putting them on the racks. Now we have a robot that does that. At one point we had lab assistants sorting them. Now that's done automatically. All of these different elements of it speed it up and make it more reliable. So today we offer a lot of our customers what we call the overnight. So if they swab employees as they leave shift at 4 or 5 in the afternoon, gets to the lab an hour or two later, we're able to have them results before the employee shows up on the shift the next day. And that's a very, very big deal because we know that every day a patient is exposed, or every day one employee exposes their coworker, it spreads exponentially. So if we're able to test every day or every other day, however often the facility needs, it really cuts down on the amount of exposure going on in the facility. Proud to have been a part of that.
How accurate are these COVID tests?
COVID tests, the PCR COVID test is the most accurate way of testing, period. There is nothing more accurate. It's about 99.998% accurate. And that's extremely important for a number of reasons. One is nobody wants to quarantine people who are negative. Nobody wants to not quarantine people who are positive and have them spread it. The human cost is really high on both of those. As well as now, everybody hears about the point of care testing and the rapid tests, and while some of them are good, it depends what question you're asking and how good you need. For two healthy people to go out and go for a jog together, to have one COVID test may be fine if you're outside. But to go visit your 90-year-old grandmother, you're going to want it even better. Now that the government changed the regulations, that every positive kicks in a 2-week protocol, 2-week outbreak protocol, that they have to test every patient and every employee in the facility for 2 weeks, the cost and the hassle of those false positives have gone way, way up. So a lot of facilities that were using rapid tests or point of care tests 6 months ago, a year ago, to augment the PCR testing, now are calling us up and saying that one rapid positive costs them 2 weeks and hundreds of hours of difficulty working with the local governments. They'd much prefer to do everything PCR so they can get that much more highly accurate test.
So where does LifeScan go from here? I mean, you had explosive growth through COVID. What happens post-COVID, hopefully soon? What will you guys do with all this extra equipment and people?
The people and the equipment are certainly not extra by any stretch of the imagination. COVID is here to stay. If you look at the new government regulations, there is these outbreak protocols that for every positive kicks in 2 weeks of testing. That's long-term. That's going to be here for many, many years. So the instrumentation and the people certainly are going to be around. Is it going to be as many as we currently have? Certainly not. But a lot of our customers have friends. A lot of our nurses have friends in other nursing facilities. And when they see what we're doing, the word gets around. So in the last 3 months, we've had customers from Boston. We've had facilities from Ohio, South Dakota, all over the country calling us up and saying, how quickly can you do this by mail? And I say, mail? We've got same-day flights. So FedEx comes, picks it up, puts it on an airplane, drops it at O'Hare 2-3 hours later, drives it to our facility. From the moment it leaves the nursing home to the moment it arrives in the lab, from Boston or from Florida, can be as short as 5 or 6 hours. So turnaround times, even from anywhere around the country, are very, very good. And it's making an impact. You know, the ability to make the nurse's life easier by giving them an easier way to collect it, the ability to very often send staff into the facility to collect the swabs or to do the COVID swabbing for the facility, the ability to have this extremely precise test that they can rely on completely has made waves in the industry. And we're proud to have done it. We're proud to be part of it.
What are the other things that LifeScan does to be able to provide and help nursing home facilities?
We're talking about COVID and the molecular testing. It's a test that can be done in 6 to 8 hours and is extremely precise. So at the end of the day, if you boil it down, COVID is a virus living in a body. We know there's more than that. There's flu and there's E. coli and there's all kinds of viruses that are often getting our long-term care patients sick, whether they're urinary tract infections or respiratory infections or wound infections, all of the like. And traditionally, those tests have always been done with a culture. A culture is you'll swab it, you'll put it on some type of growth medium, takes 3 days to get a result. In a molecular test, you can do the same thing in 12 hours. And what we find is that particularly in acute facilities where the infection is very problematic for the patient, that time difference of between 12 hours and 3 days makes a very, very significant difference in the patient's prognosis. Additionally, we find that a lot of the antibiotics that doctors give before they have clear answers are extremely toxic and, quite frankly, extremely expensive. And if we're able to lessen the amount of doses of those toxic and expensive antibiotics that the doctors have to give by getting them an answer in 12 hours instead of 3 days, everybody wins.
Do you provide training for the SNF staff on how to do the testing?
Yes, so every lab has a medical director, and everything that happens in the lab is under the auspices of the medical director. And we've hired many nurses, and we've hired many RNs and LPNs and NPs. And we go out to the facilities and we'll teach them how to do the COVID swabbing if that's their preference. But really what I find the facilities really appreciate is we've created a whole rapid response COVID swabbing team. So we've hired about 50 to 75 nurses in Illinois, Indiana, Wisconsin, and the facility will call us up, tell us they're in outbreak, and we'll send a team, 2-3 people. They'll go out there, collect the information, collect the swabs, get it back to Chicago, and get them answers straight away. And part of the reason is again, we understand the nurses in the facilities have a tremendous amount of daily work to do. And when you add on top of that the responsibility and the requirement of swabbing for COVID and the precision necessary to do it accurately, it's a lot. So for us to be able to provide employees in a rapid response team to make the SNF's life easier, to be able to test for COVID in any situation, has made a big deal, has made a very big difference to them. It's a very scary time when somebody hears that somebody at work has COVID. And whether you're downtown in a lawyer's office or whether you're on the Ford assembly line or whether you're in the naval base or whether you're in a long-term care, to find out one of your co-workers is home after having COVID, it sends a chill through the office. And as much as many people are now vaccinated, myself included, it's only about 95% efficient. And we've seen some breakthrough positives, as they call post-vaccination positives, few and far between. And people who have had it or certainly are not nearly as sick as those who are not vaccinated. But nonetheless, if somebody's vaccinated and somebody in the office pops a positive, as they say, it's worthwhile to make sure to keep your employees safe and get the office tested.
Absolutely, yeah. What would you say to your employees who going through this especially, with this explosive growth, how they handled this and maybe stayed extra hours. Like, how would you thank them?
When you say maybe stayed extra hours, I think everybody stayed extra hours. Somebody asked me, how do you judge how well LifeScan is doing with COVID? And I said, well, at one point we were leaving the office at 2 a.m., then at midnight, then at 10 p.m., then at 8 p.m., then at 6 p.m., and then a lot of people got to go home for dinner with the family. I remember one night my wife calls me up at about 8, 9 o'clock. She said, the kids haven't seen you in a while. I'm going to the restaurant nearby getting takeout. We're going to sit in the LifeScan cafeteria and we're going to eat dinner together. I said, great. So we sat in the LifeScan cafeteria and the Kutoff family ate dinner. Everybody has stayed a long time. LifeScan's always been a 24-hour operation. We've been there 24/7 for the last 25 years. Christmas, New Year's, Thanksgiving, every day, no matter what. There's always somebody in the lab. There's always somebody picking up the phone on the first ring. And there's always tests being done. So with COVID, it was just everybody staying, everybody pitching in. And at the end of the day, we knew the mission. We knew the vision. It was about making sure that the residents of the SNF and that the nurses in the SNF were able to get quality results in as short of a turnaround time as possible. And we've always been a couple days ahead of, most of the government testing in the state. Now we're at a point where we're happy with where we are. That kind of overnight turnaround time was our original vision, how to get there. And it only happened due to thousands and thousands of hours of staff time in Skokie and really around the world. There's a number of staff members living in other countries, whether they're doing billing or whether they're answering the phone off shift. It's been really a group effort, a team effort. And, I certainly can't thank them enough. Plaque the mayor presented. There was no individual pictures. Me and the mayor didn't take a picture alone. We took a picture with all the lab staff. We took a picture with the entire LifeScan staff in front of the building. It's never about me. It's never about an individual. There's hundreds of people working there. And quite frankly, no one person knows everything. No one person can get everything done. Without a very strong team of committed people willing to do what it takes and spend the hours getting it done right, none of it would have happened. And we're very proud of them.
Elly, thank you so much for coming on to the SNF Spotlight and sharing with us a little bit more about LifeScan and what you guys did during the pandemic and post-pandemic, and I wish you a ton of success in the future.
Thank you. It's been a great interview. Just been one thing bothering me that I have to fix. So let me see how this works.
Let's do it.
There we go.
Let's see this. Okay, you got this? Now that's better?
That's much better, Yitz. You see,
about
now
that?
you're looking sharp. There you go. Yitz, I appreciate being here. It's been a wonderful time. Thank you.
Yeah, thank you very much. Thank you for sharing this tremendously important part of senior care. The SNF Spotlight series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.